This is a case of a patient with metastatic non-small cell lung cancer. The patient presents with symptoms, a diminished performance status 2, and as you would expect, there's evidence of lung cancer to metastatic sites, a 4-centimeter lesion in the lung, but also bone metastases and some lymph node involvement. So this patient has stage 4 disease. That's the first thing that's critical in making an assessment. The second is the patient is a former smoker, but hasn't smoked in 12 plus years. So there still is a chance that this patient could have an actionable mutation. And then the question is, how do you treat? Significantly negative is the fact that the brain has no lesions. So that's normal on MRI. So that's basically the assessment, of this patient. And the question is what to do next. The other critical point here is we're told that the patient has an EGFR mutation in exon 19. That's very important because here you have someone with PS2, and without seeing them, I'd be very wary about chemotherapy. Certainly one could consider immunotherapy. These days, if someone were high for PD-L1, but here we have someone who's EGFR mutated with exon 19, that's a canonical mutation. The chance of response to an EGFR inhibitor should be 60 or 70%. So that begins to lead us down a very specific path of treatment. This patient has stage 4 non-small cell lung cancer, so that is an incurable disease, even in this era of EGFR inhibitors. However, it's very treatable, in my opinion, even with a performance status 2, especially since this performance status is probably due to the bony disease and the metastases of the cancer. So if this patient can actually get therapy with an EGFR inhibitor or an oral agent and responds, my prediction would be that he would feel a lot better. So while I wouldn't call this curable disease, because even if the patient responds to the EGFR inhibitor, there's a chance of resistance, and then we move to a second-line agent and so forth, I think that the short-term goals are quite optimistic ones. So I would tell the patient, you're quite lucky. You have an actionable mutation. Let's take action right away.